think that there's been a stigma about mini implants, and if so, what are your thoughts on the stigma?
Yeah, I think that there is a stigma. And what I would consider the way to remove the stigma is not around the implant or the efficacy of the implant. The stigma is around how that implant is used. So there is what we consider responsible dentistry. So years ago, go back 20 years, when mini implants started to become they were developed and they became popular. Prior to that, conventional implants were already being used. Conventional implants here in the United States were starting to be used in the late 70s and early 80s and continued all the way through. Mini implants came in sort of at the late 90s, early 2000s. And the idea for the mini is if a patient, it doesn't have a lot of bone, right? If they have been wearing dentures for a while, they don't have enough space to fit a conventional implant into the bone. So mini implants started to come into the scene so that we can provide that function, yet in a situation where a conventional implant would not be able to be used. Now, speed up ahead, the implants, conventionals and minis, have come together. They're not separated. It's really the right tool for the toolbox. So you bring everything together, minis and conventionals, and they work in concert. So what am I going to use, or what is the dentist going to use to best treat that particular patient? The stigma around mini implants is that mini implants, if we're looking at implant stabilization, mandibular, especially the lower overdenture stabilization, is exactly what a mini implant is used for. That is the bread and butter. You will have just as much success doing that treatment with conventionals. Where things start to unravel a little bit is when dentists choose to move away from the intended use of the mini implant. And dentists are free to do this. They have the DDS after the name. Mm-hmm. They have their doctors, and they're able to do this. This is not something that's necessarily bad, but they push the envelope of how this implant can be used. For example, torque values. So if you use a mini implant, let's say in a posterior on a crown, there are cases that are perfectly, wonderfully work well. But if you have a person who's maybe younger, a male, and likes to eat steak and has hard, forceful biting force.
I have those things, just not the youth. All right, go ahead.
The torquing on a posterior molar is going to be much higher. It's going to exceed the thresholds of what that implant was designed to withstand. So that's why a conventional implant is a much better choice, because they're larger, they have more material, more titanium around them, and they can handle much more force. So I would say that the stigma around mini implants is primarily where the case planning was not desirable and ended up with an undesirable result.